into, how this could improve. So why would a patient, use this at home? How can this help a patient or an employee or a student in a school who might be, asked to use the software at home?
Well, there's a couple pieces to that. There are so many different symptoms that are attributable to COVID-19. But if you look at any list, it's quite likely that you might feel fatigue on a given day or have a headache. And so these lists that are published by the CDC and others are of course very well intentioned and the best evidence we have, but because it's just a list decoupled from other vital signs and other intelligence, it really makes the patient or the layperson have to interpret their symptoms. And I can tell you from personal experience, even doctors aren't really equipped to do that in a novel disease. Additionally, there's such a wide range of presentations and courses in this illness. Many people I'm seeing now were diagnosed on the basis of an exposure or some mild symptoms a week ago or more, and then end up hospitalized and severely ill, 7 to 10 days into their course of illness. And that's a very unique feature of this virus. We've heard reports of people, suffering very severe consequences and even dying at home. And one of the hypothesized mechanisms of that or reasons for that is that the oxygen level can fall pretty dramatically in this virus without there ever being very significant symptoms. So one of the tools in COVIDx is a home self-monitoring module or application that can help folks who are diagnosed with COVID-19 know when to seek higher levels of care. And so we can hopefully get treatment started sooner. The few treatments that we do have, we have every reason to believe, based on kind of hypothesized mechanism as well as the research coming out, that the sooner you get them started, the better. But that said, they're still only administered in the hospital setting. So if we know that someone needs to be hospitalized when they need to be hospitalized, we have every reason to believe that that would give them a better outcome.
Yep, makes perfect sense. And, to sort of wind up that discussion, if you look at the ways we're trying to tackle preventative care right now, remotely, in terms of technology or in terms of existing practices and institutions, can you talk sort of about why or how this particular approach, maybe is an improvement over existing standards of care?
Right. So I think one unique feature of COVIDx is that it does leverage machine learning and artificial intelligence. So it's derived based on both the guidelines that we know about this virus, but also deep clinical data sets that emerge around this virus. Coupling that with the artificial intelligence that learns a user's baseline health. And so again, contrast kind of a multimodality approach to a rules-based approach. A doctor might say, well, if your oxygen falls below 90%, please call your doctor. Well, I know that mine is always north of 97%, usually 98, 99, and that would be expected for someone who's healthy without any other, lung disease or cardiac disease. And what COVIDx can do and will do, if I ever start to have my oxygen saturation fall, it will understand that 94% is a significant deviation from my baseline, and that will flag my vital signs, particularly if it's in conjunction with other reported symptoms, no matter how mild they might be. So this artificial intelligence approach to this problem, particularly when there are a lot of moving pieces, lots of different data inputs, can really help patients and providers, institutions make better sense of their employees' health. And again, gets back to directing testing, directing stay-at-home recommendations, directing when a patient ought to seek higher levels of care, present to the emergency room, et cetera.
Makes perfect sense.